If you want to fix scoliosis and the back pain it causes, you're in the right place. My name is Daniel Rabenov. I know exactly how it feels. This is how my back looked like when I suffered from back pain for 10 years. And this is how it looks now that I'm pain-free. Since I learned how to fix my back, I became a certified posture therapist and I've been helping thousands of people in my clinics and with my online programs. And in this video, I want to help you as well. If you have scoliosis, you have pain, let me show you some exercises and explain why they work and how they work. Alright? So scoliosis is a side curvature of the spine. Imagine that you can see x-rays of my spine. If I bend my body this way, my shoulder goes down, my hip hikes up here, you can imagine pretty much that my spine is going to curve outward this way. And the same happens if I bend that way. So as you can imagine from there, the side curve of the spine isn't the problem of the spine itself, it's the problem of the shoulders and the pelvis and the hips that push it one way or the other. Of course, then the logical conclusion is we shouldn't focus on the spine, we need to focus on the shoulders and the hips to correct this curve, the side bend of the spine one way or the other. Makes sense, right? So how do you do it? When I lowered my shoulder and hiked my hips, I did it using my muscles. So the muscles are responsible for the position of the shoulders and they are responsible for position of our hips. That means that for us to correct curve of the spine, we need to correct position of the shoulders and hips, and we can do it by recruiting muscles to help them change the position of our joints. So how do we do it? Of course, with exercise, because exercises train our muscles to be in one place or the other. I'm going to show you 5 simple exercises that you can do today to improve your posture and reduce your scoliotic curve and feel better overall. Are you ready? It's gonna take you less than 10 minutes, I'm sure. So this first exercise is called static back abdominal contractions. What you need to do, you need to lay down on the floor, put your feet up on a couch or on a sofa or on a stool. Ideally, it would be at 90 degrees to your body. Relax a little bit, and the exercise itself is happening here. So what you do is you breathe with your stomach, you exhale, and when you fully exhale, you contract your abs. Hold it for a few seconds, let go, breathe in, breathe out, contract. Squeeze your abs, let go. So breathe in, breathe out, all the way, squeeze, hold for a few seconds, let go. Do this 20 to 30 times. That will help strengthen your core muscles, your abdominal muscles, so that they can keep you more upright and stabilize the position of your pelvis. So the second exercise is called standing windmill. What you need to do is come close to the wall. So your heels, hips, and shoulders need to be touching the wall. You stretch your arms to the side, and then you bend one way and the other. Do it 5 times on each side. We're stretching the muscles on the side and we're teaching your body to be upright, not to be slouching. So this exercise helps to restore your vertical position. So 5 times on each way. Then you need to do the second set. And when you do second set, you need to put your feet a little bit wider. Put your feet a little bit wider. You have wider base to stand on. And again, do it 5 times each way. Yeah? So after that, you go a little bit wider. So third set, even wider. Arms to the side, touch the wall, and do 5 times each side as well. And after that, you come back to the initial position. So you teach your body to work with different feet position, and then you come back to the most natural, hip width apart, and do it again 5 times. And when you do it this time, you will notice that you can probably bend down a lot lower. So this exercise is called standing unilateral arm circles. What you need is, you need some sort of a pillow. I don't have a pillow here, so I have the teddy bear. I'll use it, it's just fine. What you need to do is put it between your legs and squeeze it gently. So this way you activate your muscles on your leg, you stabilize your pelvis, and this is why you need the pillow. You press on it a little bit. Don't press too hard, just a light pressure is enough. Then you put your arm to the side, make a fist like this, so not a full fist, but half fist. Put it out to the side, lower your shoulder a little bit by squeezing your shoulder blades down and to the back, and do 40 circles forward. You will notice that your body will be swinging a little bit, so that's where pressing on the pillow or on the teddy bear helps. So you do 40 circles one way with one side. So we're teaching your bodies to stabilize your core and your legs while there is a load from one side on your body. We're training your core muscles to work. We're also teaching your shoulder muscles and arm muscles to work in tandem with the core. So do 40 circles, then turn your hand so that the palm is facing upward, the thumb is pointing back, and do 40 circles that way. Once you do 40, you shake it out a little bit and do the other hand. Again, make a fist, put your hand out, press a little bit to the teddy bear, and do 40 circles. Once you do 40, turn your hand, palm up, thumb pointing to the back, and do 40 circles back as well. So next exercise, stay in the same position, keep teddy bear or pillow between your legs, squeeze it gently. We also do this unilaterally, it's called unilateral elbow curls. So squeeze your hand again, put it to your temple, and bring it forward, back, forward. As much as it goes, don't need to press too hard. We're teaching your upper back to extend under unilateral load, and we're teaching your lower body to compensate for that. So do 20-25 repetitions, then switch sides and do it again here. So as much as you go, don't force it, keep it gentle. All right, so next exercise. Okay, next exercise in this series, it's called standing overhead extension. Stand with your feet parallel, feet pointing forward, interlace your fingers in front of you, and then lift your hands up and push them as much as you can forward and behind you. Don't bend at your spine, don't do this. Stay upright as much as you can and just push your hands forward and back. And hold this position for 1 minute. What we're teaching your body is to stay upright, extended, straighten your thoracic spine, but also keeping your lower body engaged so you don't overextend or overbend. Keep your thighs tense, squeeze your muscles here so that you're standing more firm, and hold this for 1 minute. So these 5 exercises are the best exercises to correct your scoliotic curve, to train your muscles, to keep you more upright. Obviously, 5 exercises will not be a cure-all. One-size-fits-all approach doesn't really work. This is a good starting point, but obviously you'll need more to get to as close to 100% as possible. So if you're looking for a more holistic approach tailored specifically for you, I suggest you try our app. It's called Postureletics. It uses computer vision algorithm to analyze your posture, show exactly what's going on in your body, and then gives you customly made tailored exercise specifically for you. You can try them now by go into App Store and downloading an app called Postureletics. So go ahead now, go to an app store, download an app called Postureletics, get started, and thank me later.